Okay, my name is Melanie Jacob, and I'm a registered dietitian. And today I'm excited to talk a little bit about why use the EDGE instrument in your private nutrition practice. Whether you're a dietitian, a therapist, or even a physician, you can use this 5-minute tool to help assess your clients who are presenting with curious symptoms. And sometimes they're in your office and they have a lot more anxiousness, or they're in your office and they have constipation, or they don't have their first menstrual cycle and they're already 15 years old. Whatever the reason, you can use this instrument to get a very, very big picture of what's really happening. So why use the EDGE tool? The EDGE tool was developed by myself after I co-authored the practice paper on nutrition intervention, the treatment of eating disorders, published online with the Academy of Nutrition and Dietetics. It was sort of a tool that sprang from some of the research we had on understanding symptoms. So the first thing is that what the EDGE tool does is it identifies red flags for medical risk. What would be important is that you want to figure out what level of care this client in your office can function in and have treatment in. If they have bradycardia and their heart rate is coming in at very low at 42 beats per minute, or if they have other indicators of serious concern, then you would need this tool sort of highlights the red flags for medical risk. The second thing is it identifies physical symptoms of malnutrition. And malnutrition, from the Ansel Keys study done in the 1950s, it identified certain behaviors, eating disorder behaviors. And if you can identify these symptoms that are showing up in your client, you can use them as tools for psychoeducation to teach your clients what's really happening to their body and why. You can use it as a communication tool for your treatment team, whether typically most eating disorder treatment is multidisciplinary, which includes a dietitian, a therapist, a doctor. You can use this tool as a way to communicate to your team. And one of the ways that was very helpful, I had an older client that was very restrictive in her eating, but her weight didn't really show that to her. BMI didn't really show that to the insurance company. And I was able to show them these symptoms, and they were able to approve more visits because it wasn't related to the weight. It was related to the behaviors. This third thing is that it helps you really establish your treatment goals and validate progress in your client. I like taking this EDGE tool at baseline every 3 months and then annually, if necessary, and then compare your progress to the baseline. After 3 months of intensive nutritional intervention with people with malnutrition or anorexia or some form of restrictive eating, you will see a substantial reduction in behaviors that you are targeting, partly because you're feeding, and food is the medicine in malnutrition. And last part, which I really think is super important, is that the family medical history and mental health history that you gather, it basically uses it to reduce the blame on the parents. And as you know, FBT uses many tenets that are very important to reduce blame and to really activate the parents part of the team versus feeling like, okay, it's their fault. So, and it can be a springboard to discuss with your parents how eating disorders are really brain-based illnesses. So if you like this tool, if you have any questions about this tool, reach out. Check out my blog on my website, melaniejacob.com. It has this information as well as other things that might help you with your use of the EDGE tool in your private practice. And thank you for considering using that and making a difference in this population.